If I could ask everybody to please take your seats. Good morning, everyone. My name is Michelle D'Emmanuel, and I am the chair of the Mississauga, Ontario Health Team. I want to thank you all for joining us today on this beautiful campus here in Mississauga. And for those of you who don't know, we train future medical doctors and healthcare professionals on this campus, right here, close to home. It's also great to see so many of you who have been involved in our journey that we're here to talk about today. And in particular, I want to thank our local MPPs for your continued support, and to our community who continues every single day to get up and work with us to make Mississauga and West Toronto a better healthcare system. I'd also like to acknowledge the lands on which we are now on and which the university operates on. These are the traditional lands of the Huron-Wendat, the Seneca, the Mississaugas of the Credit River, and also the home to many Indigenous people across Turtle Island. Today we are also gathered in this beautiful new space, the Manjawe Nendamo Winan Grand Hall, a building that only officially opened last Friday. It's really quite fitting that we're here in this Grand Hall, because the name of this building means the gathering of minds. And this new building looks to honor the past, while it also looks to the future. That sentiment is exactly what we've been doing here in healthcare, and what needs to be done to ensure that we can continue to care for those in our community, honoring what is good and what has come before us, but looking to the future to make it better together. And in particular, over the last year and a half, the Deputy Premier and Minister of Health and her colleagues in government have been meeting extensively with us in the healthcare sector, working alongside us, listening, co-creating, co-designing to make that future bright. I have to say, I have never been more excited and optimistic about our future in healthcare than I am at this very moment, standing with each and every one of you today. And with that, Minister, it is my distinct pleasure to introduce you, the Honourable Christine Elliott, Deputy Premier and Minister of Health, who's changing healthcare as we know it.
Well, thank you very much, Michelle, for your very kind introduction, and good morning, everyone. It really is a pleasure to join you all today, and I'm pleased to be joined by a number of my colleagues from Queen's Park as well. MPP Natalia Kusindova, thank you so much for being here. Rudy Cazzetto, Nina Tangri, Deepak Anand, and Sharif Sabawi. It really is meaningful for me that you're all here today. And today is a significant day for the future of healthcare in Mississauga. And it's a significant day for the future of healthcare actually across Ontario as well. I know that for many, especially patients left frustrated by a disconnected and fractured system, today has felt like a long time coming. In fact, it was only a short time ago that our government was elected, and it was even a shorter time ago that we introduced the People's Health Care Act. Now passed, this landmark piece of legislation is enabling the creation of Ontario health teams. The scope and scale of our transformation has only been made possible because of the energy, excitement, and ingenuity of our world-class healthcare partners, many of whom are in this room today. Partners like the ones that we are here today to celebrate. Across Ontario, we are fortunate to have some of the finest in the world's healthcare professionals dedicated to delivering the highest quality care to patients. But we do all know that our health system is facing significant pressures. It simply doesn't have the right mix of services, beds, or digital tools to be ready for a growing and rapidly aging population with more complex care needs. Across Ontario, patients and families are getting lost in the healthcare system. They're falling through the cracks, waiting too long to get the care they need. And that's why our government did make a commitment to Ontarians to build a sustainable and connected public healthcare system focused on the needs of patients and on ending hallway healthcare. To achieve this goal, our government is creating local Ontario health teams. These teams will better support patients and families by connecting care providers to work together as a single team. In doing so, Ontario health teams will ensure a seamless experience and smooth transitions. For example, hospitals working with home care as a single team can begin to plan for and coordinate a patient's return home as soon as they're actually admitted to hospital. This will ensure that they can leave to recover in the comfort of their own home as soon as possible with the supports that they need at home. So I couldn't be happier than to be here today to tell you that we've reached a major milestone in the creation of local Ontario health teams. After an extensive readiness assessment process involving a tremendous amount of time, research, collaboration, thought, and effort from partners across the healthcare sector, I couldn't be more pleased to announce that the Mississauga Ontario Health Team is one of the first 24 teams in the province to implement this new model of care that better connects patients and providers in the communities to improve patient outcomes. So congratulations, Mississauga Health, for your great work. Mississauga Health represents the best of what our healthcare system has to offer. Care providers from every stage of a patient's healthcare journey are coming together as a single team to provide truly patient-centered care. This is an exciting time for healthcare in Ontario as we finally break down the long-standing barriers that have prevented care providers from working together with each other to support patients at every step along their healthcare journey. Mississauga Health will reinforce existing partnerships while also creating new partnerships with additional providers and organizations to better serve the patients of this community across the full continuum of care. It will create a system of care that is connected from prenatal, birth, to end-of-life care. The team will be focused on improving the health of the people in the community, addressing physical, mental, and emotional well-being. Mississauga Health will integrate services from primary care, home care, community care, and hospital care to create a seamless system for patients, families, and caregivers. As it continues to work to integrate care, Mississauga Health will put in place 24/7 navigation and care coordination services for patients and families. Patients will receive these services through their integrated primary care teams and the broader Ontario Health Team providers. This work will be implemented in phases and will expand over time to Mississauga Health's entire patient population. These new services will dramatically improve the patient experience and make navigating the health system easier and more convenient. There are already great examples of community providers coming together to provide integrated and coordinated patient care experiences. The Ontario Health Team model provides the opportunities for frontline healthcare professionals to expand on this great work and take the lead at doing what they know how to do best, delivering excellent quality patient care. Ontario health teams are essential to our plan to ending hallway health care as well. This is a plan that has 4 important pillars. First, we want to keep Ontarians healthy and out of hospital. Not surprisingly, we call this pillar prevention and health promotion. Second, our plan will ensure that Ontarians receive the right care in the right place. While in many ways the backbone of our healthcare system, the hospital isn't always the best place for a patient to receive care. And I say this especially at a time when many of our hospitals are experiencing over 100% capacity. Third, we are better integrating care to improve patient flow. And finally, we are building capacity throughout the system by investing $27 billion over 10 years in hospital infrastructure projects, building more long-term care beds, and increasing community-based services. Once fully operational, Ontario health teams will contribute to ending hallway healthcare by making it easier for Ontarians to move through the system and to get the care that they need. Doing so will help ensure that those patients who are ready to leave the hospital can do so with their home care supports. And they will also help to ensure that people are receiving the right care in the right place. So I want to congratulate and thank Mississauga Health for the impressive work they've done to prepare for better patient-centered care in Mississauga. And I'd like to thank all our healthcare partners in Mississauga for your enthusiasm, for your partnership, and your dedication towards reaching the goal of providing modern, sustainable, connected care for all. And our government will continue working with its partners across the province to review their applications to become an Ontario Health Team, and we look forward to future announcements. There is still a lot of work to be done, but we're confident that by continuing to work together, we can provide all Ontarians with the care that they both expect and deserve. So I thank you for that, and now I would like to ask Dr. Mira Barkoshan to come forward with her remarks.
Thank you, Minister Elliott. We're honoured that you've chosen Mississauga as the site from which to announce the first Ontario Health Teams in the province. And we are also thrilled to be included in this remarkable group. As a primary care physician, I see every day committed providers who deliver exceptional care to patients despite working in a system with its challenges. I hear from patients that when they're most in need, afraid and vulnerable, that they struggle to find their way through a complicated and confusing system. Even at joyful moments like the birth of a new child or when they're being proactive in their own preventative care, they often find the system difficult to navigate, stressful, and disjointed. And today's announcement gives us an opportunity to change all of that. The Mississauga Ontario Health Team, known as Mississauga Health, is about putting patients at the core, bringing the community together. Patients, physicians, providers, and others to create a connected system. For patients, that means access to their family physician and a full team of healthcare professionals who work together to support the patient's physical, social, and emotional needs throughout their healthcare journey. People will have access to the most appropriate member of their care team in a way that makes sense to them. It may be secure messaging, by phone, video consultation, from their home or in their doctor's office. And family physicians will have access to urgent diagnostics and specialist support to streamline care for their patients at the most needy times, ensuring patients are getting the best care in the right place by the people who know them best. Mississauga Health came together by a group of founding partners: CarePoint Health, Credit Valley Family Health Team, Home and Community Care, the Metamorphosis Network, Somerville Family Health Team, and Trillium Health Partners. Together with over 90 organizations and counting, physicians, patients, and caregivers, we came together building on the great work already done in this community, with a vision for Mississauga that would improve the health and wellness of people in this community. We aim to create a system that effectively supports people to be as healthy as they can at all stages of their life, from prenatal care to childhood through to end-of-life planning, and to support both them and their caregivers along this healthcare journey. And while there is much work ahead of us, Minister, we are excited about the future of healthcare and what Ontario health teams mean for patients. And we are grateful to be part of the change ahead. And I would like to welcome John McKenna, who is a patient advisor and who has played an important role in the development of Mississauga Health, to come to the podium.
Thank you, Mira. This is a very exciting day for patients. Well, first, what qualifies me to be here? I was rolled into the emergency department at Trillium with 2 broken legs. And after 3 weeks in the hospital and 2 more surgeries and 2 years of outpatient, I got to see the system. I got to see the good parts of it, and I got to see where there was opportunities for it. My mother died at the Mississauga Hospital site of COPD a couple of years ago, and my father is in long-term care. Because of dementia, he can't speak and he can't really move anymore. I've had many nieces and nephews who have been born in the hospital. Now their kids are being born in the hospitals here. And my wife has just begun volunteering at a local hospice and the breastfeeding clinic. The community's health professionals have seen us at our best and our worst. 8 months ago, the government issued a challenge to communities. They said, can we find a better way? And they challenged us with very strict timelines. And it was challenging. We sat around the table, this Ontario Health team, Mississauga's group, came together, as Mira said, a lot of different parties. And said, God, these are tough health teams. But we heard from patients, and patients like me said, we can't wait any longer. You need to do something now. And with that, the group came together and then started asking, how can we do it? And then the team became a team for the people of Mississauga. We look at Mississauga's population as 800,000 people. We look at it from the patient's perspective. We look at it from their family's perspective. We look at the patient's relationship with the family doctor, that trusted relationship, and we said, how can we build on that? How can we help the patient? How can we better support the families? How can we better support the family doctors in the patients through this whole thing? We had an underlying fundamental belief that everyone from the most specialized doctor to that family member that quits a job to take care of their loved one, we knew that almost all of those people have a calling, and we needed to figure out a way to allow them to do their job and do it well. But we're just at the beginning. We're learning from each other. We're learning from the best practices in the world. And we're learning how we can implement those sustainably and effectively. In closing, I want to genuinely thank Christine Elliott. You've had the courage to empower us, created the urgency to bring us together, to engage us, and trusting our frontline caregivers, trusting our professionals and our leaders and our patients to find a better way to care for our whole community. In Mississauga, we hear our community's voices and are ready to begin our transformation. Thank you.
We're so lucky to have patients like John and so many others who have been involved in this journey with the Mississauga Health team. We know that the only way to move forward is in partnership, co-designing, co-creating, and cheering each other on as we do it. I also want to say that as we think about moving forward, we have to continue with what John has talked about, that sense of urgency, that bringing people more and more together. I think Mira said, and counting, when you talked about some of the people involved. This is not a finite exercise. This is something that will continue to grow and flourish for years and years to come, and we will iterate and continuously improve and challenge ourselves. Before we close, I also want to thank the University of Toronto, who has been a great partner in this with us and for hosting us today. I see so many of our partners here, Minister. I want to thank all of you for coming today on short notice out of very busy schedules to celebrate this milestone. Minister Elliott, on behalf of our community, I want to thank you for your leadership, your government's leadership, the support, the vision. We're up to this task. We can't wait to get started, although I need to give you a little hint. We didn't stop. We haven't waited for this day. We've kept going, kept planning. And today does mark what I believe is a very special day. These moments don't happen often where we can truly transform. And so I want you to all think about that today when you go home, when you go back to the office, and think about what we're doing here, right now, changing healthcare. I'd like to invite the minister now up, back to the podium to answer a few questions, and to thank all of you for joining us today.
If there are any questions, we can take them from the mic over here. Or from the camera, if it's easier.
Good morning, Minister. It's James Moore from CFRB here. Could you maybe lay out to us how these health teams are going to operate differently than the LIN network that's in place right now, and how are patients going to see that?
Well, the big difference is that the care is going to be coordinated by the providers that already exist here. They know their communities. They know the healthcare needs of their communities. They know each other now. They're going to be working together. They're going to be providing that care. And what patients are going to notice as a difference is they're going to fill in the gaps. So, for example, there was a gap before any transition from hospital to home care, for example. In many communities, by the time a patient leaves the hospital that needs home care, doesn't know who the provider is, doesn't know what services that they'll be providing or when they will be arriving. With the new local Ontario health teams, they will know that before they leave the hospital, because what happens now is people don't always get the care they need and they end up back in hospital with complications. We don't want that. We want people to be able to recover at home with the supports that they need. And if a complication does arise, then there is going to be that care coordination that can happen back to the hospital, so that the people providing home care connect with the hospital to know what services need to be provided, and that can be done at home, not in the hospital. People want to be in their own homes. That's where they deserve to be when they've been discharged from hospital.
It can be really overwhelming and daunting for families to coordinate the care for loved ones who need a lot of help. Usually we're talking about elderly people here.
Yes.
In fact, there are full-time jobs now that you can get in this province where that's all you do is coordinate care and I guess get in the middle of families in the healthcare system. Will these changes, or I guess I should ask, how will these changes make it so that when families get into these situations with people who need a lot of care, that it's a little less burdensome and a little more humane, let's say?
Okay, well, very good question. But first of all, the local teams, so Mississauga Health will be able to work to make sure that those gaps are closed, that people will get the home care that they need. But there also is a responsibility of government there, and we did put another $155 million more into home and community care this year over last year, because we know that is an essential part of the system for this to be successful, is we've got the people providing the care, but we need to have the money to pay the people. So that's the additional money in home and community care is going to help a lot.
Are there any questions?
Hey there.
Hi.
This is Kyle with CB24.
Hi.
Teens are increasingly overdosing on common household meds like Tylenol and Advil. It's becoming so much of a problem that doctors are actually calling on Health Canada to limit the number of pills that can be bought at once. Has Ontario's Health Ministry been monitoring this growing, worrying trend? And would you support a limit on the number of pills that can be sold at once to like a certain individual in different kinds of medications, so on and so forth?
Well, we certainly have been following lots of different medications, both prescribed and not prescribed, and that is something that we want to make sure that we protect the health of our young people. That is one of my biggest responsibilities as health minister, and it is something that is both federal and provincial responsibility, in the sense that I will be speaking with the new Minister of Health on that and on many other issues, as I'm now the lead of the Provincial Territorial Health health table, and we have an agenda that we're drawing up of issues that we intend to discuss, and that will certainly be a part of that list.
All right, if there are no more questions, thank you. Are you for the meeting? Sorry, we're only. Yeah. Okay, thank